Okay, next we have Dr. Rolf Embertson. He is one of our surgeons, our first surgeon. Why are broodmares prone to colic?
It's hard to answer this in 5 minutes, but we'll give it a whirl here. The first thing I wanted to state is that colic doesn't necessarily mean intestinal disease. So, especially in the broodmare, there's some other things that happen, and they're kind of unique to the broodmare that you need to consider.
I don't think they can hear you very well.
Is this not on?
Maybe just bring it up. It's on.
Okay. Can everybody hear me now? All right. So again, it's important to remember that abdominal pain, which is what colic is, does not necessarily have to come from the intestinal tract. Much of it does, but there's some other things to consider. So what I tried to do is to put this into 3 different periods of time for the broodmare, and then what kind of things we might expect to see during that time period. And it's really important for us treating these horses to have an idea what can happen during that time period, because sometimes they don't show obvious clinical signs for us to, I'm supposed to get on the stage. See if this works. I'll get this down by the end of the night. Can I stand on this side? Good? All right. So I split it in 3 different periods of time. The prepartum, just a few days postpartum, and then after 3 days postpartum. So if you split this up and look at the prepartum stuff first, the gastrointestinal stuff is a big part of what can happen that'll cause abdominal pain in the horse. And the thing, actually through all this, these different periods, the large colon volvulus or large colon displacement is one of the most common things we see in the broodmare. And there's probably some reasons for that. I'll cover a little bit in the last slide. But we can see that through all these different periods. There is the postpartum period is a more common time for that, but we can see it any time. The other things that can happen, though, is intestinal strangulation through small holes that can happen in the abdomen. So I can drive this thing here. So this actually is a hole in the mesentery of the jejunum that it's a broodmare disease. This happens during foaling, and oftentimes we don't see a problem with this until they're back in foal, there's not much room in the abdomen, they get some small intestine through that, and they can't get it back out, and so it strangulates. And so, and then when you pull it out and they're still fairly pregnant, late term, you can't do anything about it because you can't get to the very top of where this hole is. So you end up having to get the foal out and then going back to fix this. Another thing we see in broodmares, and we also see in foals, but it's kind of a broodmare disease, or diaphragmatic hernias. It's not common, but we see that after some rough foalings, or sometimes you can't even tell if they had a rough foaling, and then halfway or 2/3 or 3/4 of the way through the next pregnancy or a subsequent pregnancy, you may see that they've got intestines into the thorax, and they can't get it back out because there's not enough room in the abdomen for it to come back out. So this is just an example of a diaphragmatic hernia. You can see here's liver and some momentum. This is the chest there. Then the other thing we see sometimes in the prepartum mare is after doing a colopexy to try to prevent large colon volvulus again, sometimes in the real gravid uterus or late term, it lays on that part of the intestine that we've sutured to the body wall, and it obstructs flow of ingestion and gas. And so sometimes the cecum distends, and we see that as a problem in some of those that we've done colopexies on. All right, another prepartum abdominal pain from the reproductive tract now. Uterine torsion, not common for some reason in the thoroughbred mare. We see it more in warm bloods over in Europe, but we do see that occasionally. It's a difficult thing sometimes to figure out if you haven't seen one before. Sometimes these are very painful, sometimes mildly painful. The rectal exam is probably the best thing to try to figure this out. Uterine artery hemorrhage in the prepartum mare is very unusual, but it's not 0. And it's important to remember that when you're trying to figure these out. And this is true of all the different time periods that I'll tell you about. The uterine artery hemorrhages, if they break through, if they bleed into the broad ligament of the uterus and they break through in the abdominal cavity, they're in a significant amount of shock. And some of those horses are not so painful. They just look, they're white mucous membranes, high heart rate, sometimes sweating, very anxious. If it is not broken out of the broad ligament, sometimes those horses are very painful. And as surgeons, we're trying to figure out, does this horse need to go to surgery or not? Because you generally, it's not a good result to end up taking a uterine artery hemorrhage to surgery. They don't tend to do well. So the separation of the tissue of the broad ligament creates pain. So again, it's another thing that's kind of hard to sort out sometimes. And then the other thing we see, which is unusual also, but we see some body wall hernias or tears through the muscular or fascial planes in the body wall. Generally, we see this on horses that have had, or in mares that have had previous foals, and it's a late term kind of a thing. Dr. Morrissey talked about high drops before. This would predispose to a body wall tear. These are not common, but again, things we need to sort out that do cause abdominal pain. Okay, so within the first few days postpartum, some of the things we see from the GI standpoint is, again, large colon volvulus. Sometimes we'll see that a day or two after they fold. And then the other things I've got up here is cecal or large colon perforation. This actually occurs during foaling. It's a parturition event, but we don't see it for another couple days after they've foaled. And the reason for that is there's been trauma to the wall of the cecum or the large colon. Usually it's cecum. That's the most common place it occurs. And then it affects the motility a little bit. The cecum distends some. That part of the cecal wall is compromised. The next thing you know, it perforates. And by the time you get in the abdomen, this is what you get. If we get in this situation, we're done. Okay? So we try to recognize that before that actually happens. The other thing that can happen is kind of an indirect trauma to the bowel, but if the foaling event has actually sheared off some of the mesentery is that tissue that contains the blood vessels that supply blood to the intestines. If it's torn through that mesentery and adversely affected the blood supply to the bowel, what will happen over the next 2-3 days is you'll get necrosis or death of part of that wall of the bowel, and it affects motility. So they gradually start getting uncomfortable. And sometimes when you get in there, you can find a segment. This is the small colon here. This is the tear you can see in the mesentery to the small colon. If you can get access to that and exteriorize that, you can resect that part of bowel and hook up the ends again. They can do fine. Sometimes it's farther downstream towards the rectum. It's very difficult to get to. So again, these cause pain 2 to 3 days after foaling. A lot of times they're not very painful to start with. Then stuff that involves the reproductive tract, uterine artery hemorrhage. Again, this is the time that usually happens, first few days after foaling. And almost everybody in this room would know that. These horses, again, if it's containing the broad ligament, they tend to be more painful. You don't want to take these to surgery if you can help it. The uterine tears, which is I have a picture of that on the top. This is the tip of the uterine horn. That's typically where the uterine tears occur, probably 2/3 to 3/4 of them. And a lot of times these are not dystocia horses. It just happens. And I think there's an awful lot of movement of the fetus coming out, a lot of straining and pressure within the abdomen, and the next thing you know, there's a tear. Usually it's at the tip where the hind feet were. And you typically don't see these for a couple days. The abdominal pain associated with this usually is mild, and it comes from peritonitis that they get. And if you recognize this and get into it fast enough, we can save most of these mares. So it's a mild abdominal pain. The next thing you see down here is actually, that's uterus hanging out. That's a painful event. I don't know how many you see that. This is not very common to see, but when it occurs, that mare is quite painful. And it's hard to get these pushed back in. A lot of times we have to anesthetize and hang them upside down, push the uterus in, and make sure that we distend the uterine horns, and then suture vulva shut for a day or two to try to fix that. So again, this is a very painful event. This is a couple of days later, not so painful, but can be quite lethal if you don't take care of it. Okay, greater than 3 days postpartum. Again, usually this is when you see the large colon volvuluses and displacements rather than the other two periods. Most of them are occurring within 2 to 3 months of when they foal. And so I imagine that most people want to know why broodmare is more prone to this, and that was the reason for the question. I think a lot of it is the stretched out abdomen after they fold. This also corresponds to the time that the grass is starting to get kind of lush in the fields. And there's a lot of gas production. If you go in on some of these surgeries, part of the large colon is very gas thin, and the other part's very heavy from having wet grass in it. And I think that there's some reasons for there's a change in the intestinal motility. This oftentimes you hear that it's occurred right after they've fed some grain. They're going through the barn feeding their mares, and they hear a disturbance, earlier or farther down in the barn. And next thing you know, this mare is very painful. So some of these occur very acutely. Some of these kind of displace and then eventually become an entire volvulus. And that's where much of the research is going right now, is looking at the microbiome in the hind gut. We looked at all the large colon volvuluses over a 25-year period. Had about 1,000 mares in the study. And a couple things to point out here. The time of admissions, for those of us doing emergency duty, you think it's always at night. Well, it wasn't. The most common time we see a large colon volvulus is first thing in the morning, 6 to 9 o'clock, something like that. And then this kind of just proved the large colon volvulus, the months that they're admitted to our hospital for surgery. This is March, and here's June. So most of the large colon volvuluses are occurring that March through June, which has to do with, a month or two after they fold. And that's it. This actually is Hopper's kit. I couldn't resist putting this on here.